So what I want to do in this little segment is speak to the prospective client. And my message is help is on the way. You may have difficulty managing your use of alcohol. You may have difficulty with gambling. You may have difficulty with biting your fingernails or with drugs of some kind. Or you may have difficulty with social media or pornography. Did I mention eating? I'll put that in there again, or with binging and purging. Those are or depression and anxiety. Those are the things that people have come to me for, which is pretty much the whole range of problems that people have. So now, I want you to know that help is on the way, and I'm not going to go deep or get all theoretical with this, but I want you to know just briefly, why do you have these problems? Well, they originated in childhood. And the reason that that you have difficulty understanding it is because all of those impulses, motivations, pictures, and stuff from childhood that motivate your drug behavior, your overeating behavior, your anxiety or your depression and so forth, are in your unconscious. They're based on memories, on images, on emotions that were formed when you were a baby. And they operate in your unconscious, and they operate very fast, very rigidly, and they're not available to be evaluated. So they just move you to the dope house, move you to eat more food than you want to eat, move you to depression or anxiety, and then you're left wondering, how did this happen? And there are plenty of programs, and I'm all in favor of 12-step programs of all kinds, because I send my clients to them because they provide support. But the 12-step programs, if you have a sponsor in 12-step, you work the steps and so forth, you're not going to get to the kinds of core issues, childhood issues, that a therapist like myself can help you get to. And so 12-step is good, but that type of therapy is called cognitive therapy, meaning it operates on your thoughts. And behavioral, meaning it's trying to change your behaviors, to stop overeating, stop going to the dope house and so forth. Only problem is, thoughts aren't what causes people to overeat. It's emotions, it's childhood trauma and adversity. And so the therapy that I practice and that I teach to many other therapists and that I want to make available to you through this little snippet of video is called affect. That's another name for emotion. Affect-centered therapy. And it begins with teaching you skills to regulate your emotions. When people overeat, for example, they're not overeating because they think they should. They're overeating because they've learned somehow, they've had a traumatic experience in childhood around food that usually involved one or the other parent and the emotion of shame. And so they're impelled by these childhood traumas to overeat. And even though they know it's not such a good idea, even though they know they have a OA sponsor, for example, they still overeat. And so what this therapy does is it works at the level of emotion, and it works at the level of trauma, adversity, and misfortune, and it resolves those. And the whole idea is it doesn't change the thinking, it changes the deep unconscious knowings, the deep unconscious maps that people learned in childhood about how the world works and that drive their behaviors today. So if let's suppose you have a problem with anger, many people have no idea why they have a problem with anger. Road rage, for example, or in relationship. why is the husband so mad at the wife? Why is he always yelling at her? And or why is she always yelling at him? They are unaware of the emotion of anger, for example, and where it comes from. And so in this therapy, I help them recognize the onset of anger, what the sensations are in the body, usually tightness someplace in the hands that make into fists, in the jaw, the shoulders and neck. Many people are angry all the time, and then periodically it erupts. Well, I help them, and this is something that 12-step wouldn't be able to do. Therapists can help them uncover the childhood experiences. Many people don't realize, haven't thought, don't remember that their dad was always angry or their mom was always angry, always finding fault, always yelling and cursing. And there might have been some good times, and they might be able to say, oh, I know my dad loved me, I know my mom loved me, and that's usually true. But there's the part about the yelling and the cursing and the blaming, and that becomes the basis for deep knowing, a map that's formed in this poor little person's brain about how people should relate to their children and how husbands relate to their wives and wives relate to their husbands. And so later in life, when they get into a relationship, they find themselves acting out angrily. And it's a puzzle, and it's also very disturbing because it they love their wife and they can't understand why they yell at her. And the wife loves the husband, but she's tired of the yelling. So these are the bases for the affect-centered therapy, and I hope you can find a therapist in your area, wherever you are, and take advantage of this affect-centered therapy to learn how to regulate your emotions, to learn where the poor regulation came from, to learn how the symptom of addiction or alcoholism or the like arises from the deeper problems of emotion regulation. I hope this benefits you and that you find the relief that you're seeking. Thank you.